Welcome to A Window on SAHMRI, where we take you inside South Australia's independent not-for-profit health and medical research institute. Each episode, we get to know the people driving our life-changing research, getting into what motivates them personally and how their work is delivering a brighter, healthier future for all. I'd like to start by acknowledging that we're recording this podcast on the traditional lands of the Kaurna people and pay our respects to their elders past, present and emerging. Let's start off with a bit of background for you both. Where do you call home, Odette?
Oh, that's a really good question. So probably two places. So I have a home here on Kaurna country. I've been here now for 18 years. So I do consider this my everyday home, you know, where I work and where I live. But I also am very connected to North Queensland. So when I think about home as a long life place, my home is North Queensland. And I'm very proud of the fact I'm a North Queenslander, by the way.
And just ask her.
I have to be careful when and where I say that.
Where she's talking about NRL.
Oh, right. Yeah. Queenslander.
Yes.
Yeah. And what about you, Kim?
So I've grown up here on Kaurna country. I grew up in northern Adelaide, so I do consider Adelaide to be my home. However, I do have family connections to Central Australia. So my father is originally from Alice Springs, and my Aboriginal side of my family are from Alice Springs. So I have a strong connection to Central Australia, and you know, I think that's the spiritual heartland of Australia, but that's my opinion. But I'm also very connected to the Yorke Peninsula because that's where my mum's from. And so I spent a lot of my childhood travelling back and forth to Pine Point, which is between Ardrossan and kind of Port Vincent and Port Julia's in between, just after Pine Point. And so I spent a lot of my childhood there. So I really love the Yorke Peninsula as well. But I am certainly a South Australian with my Arrernte connections and Anmatyerre connections.
And you get to spend a fair bit of time travelling around the country and the state in your role, or more so recently since we got over COVID?
Well, actually, Odette's probably been doing a bit more travelling than I have, but we do obviously provide, well, the work that we do has a statewide focus. So we often are doing projects in, you know, country locations or in other jurisdictions. We partner with other collaborators in other states and territories, but predominantly my work's probably more focused in South Australia, and we're just, like I said, just starting some new partnerships in a heart study. And Odette's involved in some national committees, which takes her obviously to Canberra and some other parts of Australia as well, contributing to, you know, the NHMRC and other organisations like that. But we do have, a statewide and, you know, at times national focus.
How's South Australia unique, in your view, in relation to Aboriginal health research?
Well, the majority of our research is here in South Australia with different communities. I think that when we design research or design models of care, we're predominantly designing them with South Australian Aboriginal community. And some of those bits of work, whether it be models of care or guidelines or ways of working, ways of doing research, we've been able to share those with communities outside of South Australia who have implemented the work and the guidelines or the programs for their context and for their communities.
And how do you ensure community priorities shape your research?
Well, our foundational work was very important. So obviously we've had our 10th anniversary last year at SAHMRI, and Odette and I were, you know, the second and third Aboriginal employees in the organisation, behind obviously Professor Alex Brown, who was our inaugural theme leader. And so Odette and I really supported Alex in developing and growing the Wardliparingga theme. But there was a couple of foundational pieces of work that we did. First of all, our first partnership was with the Aboriginal Health Council of South Australia who's our peak body for Aboriginal health services in this state. And so what we did was a kind of mixed method approach where we undertook qualitative interviews with Aboriginal community controlled services and health leaders across South Australia to ask them what their public health priorities were from their perspective, from a research perspective, and what were the things that were worrying them. And then we also did a retrospective audit of the Aboriginal Health Council's Aboriginal Health Ethics Committee. And we looked back over 4 years of approved ethics applications, Aboriginal ethics applications, to understand what research was undertaken, what were the questions that were being answered, in what geographical regions was the work occurring, what was the benefit for Aboriginal people. So a range of questions, and those things combined, we developed up what's called the Next Steps report in partnership with the Aboriginal Health Council, and it's really been that report that has grown our program of work over the last, 11 years. So that was really important. And we also heard through those consultations that our Aboriginal leaders and services really wanted to see some reform around the way research was conducted. And so we then developed the South Australian Aboriginal Health Research Accord. And also Aboriginal services and leaders wanted more information and data available to them and wanted more control around that data. And so Odette led a piece of work which was called the Landscapes, which brought together, a range of administrative data sets based on where Aboriginal people live rather than kind of government boundaries. And so and then looked at, the interpretation of that. She had Aboriginal people involved in the interpretation of that, and our communities have utilised that data for service planning, for new health services, and in a range of ways. And that's something that communities still, really want access to. Because when we see Aboriginal health data, it doesn't drill down into actually where people live. You'll, see data that compares, remote, regional and metro people, not Port Augusta and, say, Whyalla. It doesn't, get down to that granular level, whereas this work did, and that was really important. And so, really, Odette was doing kind of Indigenous data sovereignty work before that language was being utilised.
Great summary. You can really rattle all of that off there, but there's a huge amount of work that you're referring to there. What's it been like for you to be a driving force behind all of this?
I think, it takes time to be able to look back and understand the work that we have done. Like when you're actually in the thick of it and doing it, it's probably... Well, for me, it's extremely enjoyable. It's very rewarding. There's obviously challenges as well, but to be able to have such solid foundations and to be able to look back, it really collectively over a 10-year period becomes a pretty amazing body of work. And we can also see the relationships and the partnerships that we've established over time, the growth in the community around their understanding of research, about their roles in research, which have changed from being participants in research to actually governing our research, to being leaders and equal partners in research now. Some of the evidence of that is, we actually have organisations, Aboriginal organisations and Aboriginal communities who come to us, Aboriginal leaders in South Australia and across Australia who come to us and ask us to do pieces of research. So that is in itself an absolute privilege. When we're talking about the South Australian Aboriginal Research Accord, which is the work that Kim and Aunty Chris Franks led, there's principles. There's 9 principles that define the rules of engagement and the way we conduct ourselves with community. And we, across all of our research, we strive to implement those 9 principles. And so that keeps us accountable to, doing research the right way. It also allows us to evaluate how, are we actually implementing the principles? To what extent are we implementing them? And what type of impact is that having on the relationships that we have, on the outcomes of our research?
And you can look back in hindsight and see it all line up in a way now that you can be so proud of, and see how far we've come. But in the nitty-gritty, in the day-to-day, it doesn't necessarily feel like that all the time. Have there been times that stand out that have been really frustrating, where you feel like you're not getting anywhere? And what's your perspective on that part of science?
I think since taking on the co-theme lead role, that probably has become more prominent in my working world, like, because your focus is not just, the sort of establishment and implementation of research projects, but it's the strategic direction and the sort of the nurturing, I guess, of an entire theme.
Higher level.
Yeah. And so when, like, I was in Bundaberg this week working with the Bundaberg Aboriginal community and partners from Australian National Uni to co-design a heart health program. So we were working together. There was about 40 of us with the health service to look at what a heart health program would look like with them, for their community. And so that's a very, hands-on, interactive, that's 2 days of doing a lot of really rewarding work. And that type of stuff is what you love, or what I love. You can see it coming to life. So day one, we started with nothing. By the end of, day two, we had a program, a broad outline of what the program would look like. When we're leading a theme, the strategic vision's great. Like, that's a lot of fun. Kim and I love doing that work, but it's the execution of that can be very difficult. And you can't, it's like the reward is the look back. It's not necessarily, what's happening right here,
there's so
right
many
now.
variables, and there's not that simple A to B.
Yeah. But yes, it's...
Yeah, I suppose, and the other challenge for us is that obviously our work, the work that we do, it has to make a change. It has to be of benefit to our community, because otherwise why are we doing it in the first place? So, making sure that we are able to translate our work into meaningful change. And, translation is a challenge across research broadly. So it's not a unique problem just to Aboriginal health, but it's certainly something that we're very mindful of with the work that we're doing, is how do we ensure that, Odette will often say we do much more applied work because we need to make sure that it is of benefit. And so that translation piece is really critical. And so making sure that the right people are around the table, and we're thinking about that at the beginning of the process to ensure that we get more success in terms of the translation. And I think that is a challenge for everybody in research. But, with our partnerships and relationships, I think we've had a lot of success. We want more, of course, because, that can take time. But, we've been able to influence policies and models, and some of my work's more at the translational end. So we're, at the moment we've got a large diabetes foot program that is aligned to addressing the complications of diabetes. Obviously, foot health is a really important part of diabetes care. And so that's really the translational end. And so, we're working across 5 jurisdictions in Australia. We're increasing access to screening services for people getting access to medical grade footwear. We're seeing improvements when someone has got a foot problem, because that's really important, because time is really critical. And ultimately what we're trying to do is reduce the experience of amputations in our community, because we have something like 38 times more amputations in the Aboriginal and Torres Strait Islander community as a result of diabetes complications when we compare that to the broader population. So I suppose we're in a unique position where we're, developing, co-designing, programs, co-designing models. We're doing primary research, but we're also doing translational work, which is, I think, also very rewarding, and we're evaluating that at the moment to measure the impact of that program, and the early results are, really promising.
What's the reality of what it takes to actually influence policy and see that translation from identifying a problem and then going through the process of creating a program to the point where you're changing policy? Like, what have you learned about, with all your experience, of what it actually takes to make that translation impact?
It takes things to be aligned. Like, we know, there's already research and evidence out there around, when a policy change is made that's been, come from research, there's all these factors, and most of those factors, if not all of them, are outside of our control. So I think from my sort of understanding on what we've done over time, it is about having relationships with the right people in the right places in the policy space and being agile. So if there is a request for something like, information, because we have a body of work, we can draw on that to provide it to the people that require it. But, the amount of policy that we've directly influenced is hard to understand, because there's so much contribution that might go into like a policy sort of change.
Yeah. I mean, some of our chronic disease policy work has informed, workforce models. So, for example, in the Royal Adelaide Hospital, there's been Aboriginal health practitioners in places like cancer, in the heart area, in the emergency department, and some of that's been based on our evidence that's been generated through our heart and stroke plan, our cancer plan, and our diabetes strategy. There's an Aboriginal health practitioner now in the high-risk foot clinic in the Royal Adelaide Hospital. That's been a part of our work, developing up a Aboriginal diabetic foot strategy in South Australia and working in partnership with the vascular surgeon, the director of podiatry, with those teams. And so some of those things, we don't always kind of measure, but that's a direct contribution of us working in partnership and generating the evidence for the system to then respond. And that's now, a substantive role in the high-risk foot service. We seed funded the establishment of a telehealth model in the Royal Adelaide Hospital, so that Aboriginal people in, rural and remote communities could get access through their clinician to a high-risk foot clinic in real time, rather than, being sent down to Adelaide because the person in the country region wasn't quite sure. The aim is to be able to get that advice much more quickly and to have an assessment much more quickly, and hopefully, reduce the stress on people having to leave their communities, and also getting that care, the right care at the right time, to then obviously, reduce their risk of, more serious complications. So, and I mean, that's just in South Australia, and we've got other examples, particularly, around the foot space across the country.
But being able to develop a pipeline like that has huge flow-on effects, which continue to have a positive impact.
As a sustainable model, which is just fantastic. And similarly, there's been, increased services in, Alice Springs Hospital, in the Kimberley region, through some of our seed funding. It's then been picked up by those, government services. And then there's also the relationships and all of the work that's happened in the community-controlled services, increasing access to podiatry care, those escalation pathways where there's a problem. And bringing those partnerships together has been really critical, and I'm really excited to see what the formal evaluation findings will be able to produce, because I think that it's going to be an amazing piece of work.
Absolutely. Yeah, the reach is incredible. We've also developed policy. So we were approached to do that when we were first established around South Australian Aboriginal diabetes strategy, as well as a heart and stroke strategy, and contributed to the cancer plan, the Aboriginal cancer control plan. The implementation of those plans, Kim led through a chronic disease consortium that brought together all of the key sort of stakeholders across the system who had the mandate for implementation of those plans. So that was a 6 or 7 year project that was led with through Health Translation SA. So those things are extremely rewarding because you can see the change and the implementation occurring in real settings, in real time. But a formal evaluation of those pieces of work hasn't happened to the extent that we would like evaluation to happen. So that's one of the things I think we've learnt is when we are doing the translational work is, how do we measure the impact of that work? It's not straightforward. How do we measure the impact of our research over the last 10 years? That's not straightforward either. But it would be, I think it's really important that we work towards being able to measure it in some way from different perspectives, including from the Aboriginal community's perspective.
Why have you dedicated your careers to this mission?
Look, for me, I have always worked in health. I did my undergraduate, I did a Bachelor of Health Science, and then I worked in research for 2 years. And so this was with going into too much detail. This was in the mid-90s. And as you could imagine, research back then is very different to research now, particularly I can only really talk for the Aboriginal and Torres Strait Islander health research. That experience was okay, but it wasn't that great. And then I went and worked in Thursday Island for the Torres Strait Health Service for 7 years. And I was in a role of policy and primary health care, and that's where my love of primary health care came. But I also saw we implemented a research project that brought a chronic disease recall system into the Torres Strait. And at that time, it was a manual card system. It's now on a computer, and that is now gone across Australia, that system of recalling patients with diabetes for a minimum number of checks to keep their diabetes management on track. And we used to have a whole lot of people from the Torres Strait go down to Cairns or Brisbane and either never return or come back with a lower limb amputated. Then they go back down, get another amputation, to their knee, and then eventually come back without limbs. And you'd see people along the street. And when this project was implemented, which was the start of my time working in the Torres Strait over those 7 years, by the end of it, there were a lot less people going through amputation because of this recall system.
So you could see that impact.
You could see visibly, like it was incredible. And also we implemented an Aboriginal and Torres Strait Islander model of care. And it was run and led by Torres Strait Islander workforce. So the model of care it went from prevention all the way through to community development. Before, the model of care was just clinical care. So there were no big prevention programs. Education and health promotion was sort of done when you came in for your clinic assessment. We set up teams that specifically focused on health education, health promotion, prevention, and then community development. We worked with local councils to improve the context in which people lived.
So you got experience with the full picture.
Yeah. And then there were Aboriginal and Torres Strait Islander managers in all the clinics. So that was a workforce. So this was like a faceted approach to changing healthcare in the Torres Strait from the perspective of, the way we view health. And so when I saw all of that coming to fruition, there was a advertisement put out for an NHMRC scholarship to do a PhD, and I thought, that was something that interested me, and I was one of 8 people that was successful. So I moved to Adelaide because that was part of the agreement. I did my PhD at Uni SA, and I evaluated what we'd done in the Torres Strait, a section of that. So my PhD found the more resources that we put into these discrete primary healthcare services in the way of Aboriginal health workforce, the less preventable admissions, or the less admissions we have for diabetes. So then when I'd finished my PhD, SAHMRI had been operating for a couple of months, and that's when Alex and I met, and Kim, and we started working here. So I think my initial exposure to research wasn't great. I've always been interested in health, the short story. And then I realised actually when you have, Aboriginal and Torres Strait Islander people working in research and being able to work in research, because it was a very different environment from when I worked in research in the mid-90s to, having Alex as an Aboriginal professor. You didn't have to explain how you would, what you were doing, how you were doing things, why you were doing it, because it was the right way. So when we built the foundational work, that just allowed us to get on with the business. It's gone from there and sort of grown and matured. So I can see the benefit of research in our population.
Why do you do what you do?
Well, I was just reflecting when Odette was speaking, actually, because my pathway into research is quite different to Odette's, but I have always worked in fields where, there's a social justice, perspective. I've worked in community services, predominantly in housing. I started my career in housing. And then, probably, 10 years into my career, I was working on the front line. I was dealing with people that were, experiencing homelessness, domestic violence, all of the things that our community members experience in the housing area. And
how did you get into working in housing?
I actually started as a school leaver. So I finished year 12 and started in the public service, and I was 18 and started in the housing trust and did a couple of months in the city, and then I basically went to the Salisbury region where I grew up in Salisbury. And I used to work on the front counter at the Salisbury Housing Trust office, and I learned a lot.
What made you want to do that?
I was interested in social justice. And so I probably didn't choose a housing pathway, but it was something that I learned a lot and I was really interested in. And so I did, whatever training was available. I did some leadership training, and it was when I kind of moved into then the policy space that I realised that I knew what was going on the ground, but how would I be able to influence that and articulate that in a policy space? And so that's
interested in social justice because you'd seen a lot of injustice.
Totally, and also obviously being an Aboriginal person coming from the northern suburbs where you can see disparities in people and families and all of those things, and wanting to be able to help people. And so that was really, I suppose, what interested me in kind of working in that space in the beginning of my career. And then when I went into the policy space, I could see, you know, I really wanted to understand evidence-based policy and how do we kind of translate the, you know, what was coming through the research into policy, and then how do I articulate what I had learned and seen working on the front line. And so that's really when I started to think about, okay, maybe I should go to uni. And so I was, you know, in my late 20s when I started my uni kind of life, and I started with quite a broad degree because I really didn't know what I wanted to do when I grew up. And so then I did something quite broad, and then some of my colleagues had started a program through Deakin University, which was a Masters of Public Health, and I wasn't enjoying uni because obviously I was a bit more mature, and I was studying with younger people, which wasn't an issue, but you know, our levels of ethics around our work, you know, our work ethics were probably a little bit different. So I was carrying a bit heavier load, and I wasn't enjoying that side of things. So I then went into I got accepted because of my work history and what I'd commenced in this degree. I got accepted into a Masters of Public Health. And so that really then I got really interested then in research. And then SAHMRI was kind of being, you know, I was working in the system. I was working in the Department of Health in the Aboriginal health area. And so I knew about SAHMRI. I saw some of the early plans around SAHMRI. And then I met Alex Brown at a meeting around rheumatic heart disease in Sydney. And then I heard that he was coming to Adelaide. So I rang him and said, what are you going to do about building the Aboriginal research workforce in South Australia? And, you know, what are you going to do to help Nungas, you know, get into research, and what would those pathways look like? And at the time I was already on the Aboriginal Health Ethics Committee here in South Australia, and I sat on the department's Health Research Ethics Committee. So I had an interest in research. And so then Alex said, well, let's have a cup of tea. So I went to meet Alex, and he was interviewing me basically. And then from there, I kind of, he said, would you like to come and work for me? And so that was really my pathway into SAHMRI. And I just started my Masters of Public Health. So then he was able to be my supervisor, you know, in terms of my Masters. And now I'm about to commence a PhD this year, actually. We're doing some work. Our program, as we've mentioned, has grown over time, and one of the areas of work that we've been working in is healthy ageing, and a passion of mine is stolen generations. And so healthy ageing really affects stolen generations because last year, actually, every first generation survivor stolen generations are now eligible for aged care services, and we don't have the right responses to support them in their healthy ageing. And so we're partnering with the South Australian Aboriginal Stolen Generation Corporation. They're the leaders of the research. We're facilitating that on their behalf, and that will become a part of my PhD.
It's exciting. You've always got something new to strive towards, and it seems like such a broad area of focus where you get to influence so many parts of society in a meaningful way.
Yeah, and I suppose I probably didn't answer your question in its entirety, but I suppose it's the passion of being an Aboriginal person, you know, seeing, you know, the strengths of our community, but also some of the challenges, and being able to, try to make a difference and to be able to, you know, think about the next generation and you know, really try and make a positive difference is probably what motivates me every day.
What have you learned from each other?
Well, we're very different, which is good because we complement each other. So obviously, you know, Odette's had a different pathway and into research. So I'll lean on Odette for some of that technical knowledge at times and things like that. And so Odette's going to be my supervisor. Ask me this in 3 years. Odette's going to be my primary supervisor for my PhD, which I'm really excited about. And I know that it's a challenge, and that, you know, doing a PhD changes your life. Everybody I've spoken to that's done that has told me that, and that your relationships with your supervisors are really important. Odette is super smart, clearly, brings all of that research knowledge. She brings, you know, knowledge from her community. She's a part of our community now. You know, she's a strong leader. You know, she's very clear about her, you know, what we need to be able to do to achieve, you know, good outcomes. And so I think that, you know, we're able to complement each other in terms of our approaches, and we bring different skills and experiences and those types of things. So I think we, you know, and we're honest and open, and we have good communication, which I think is the success to being co-theme leaders, because if we're not on the same page, then that's going to be a problem.
A lot of pros there.
Yeah. Oh, look, fundamentally, we have the same values.
Yes.
I think that that's what makes the co-leadership a success, because we can make different decisions about the same thing, but the underlying values are the same. So the decision will always be grounded in those same values. So we've never had a difference in, you know, opinion around those. And because we've worked with each other outside of being co-theme leaders, like for the last 10 years, we knew that we had those. We didn't have to have a conversation about it. Kim, her strengths are really in the relationships, the partnerships with community, with organisations, with stakeholders, and the translational side. So the policy, you know, the knowledge translation of having this program on a piece of paper and actually translating that to being done in practice in the real world context. And I've learnt so much from Kim in relation to that. Like, it takes, you know, a lot of investment in relationships and partnerships, and my personality is not as talkative. So I just love it when we go to things together. It's like, at least the pressure's off for me. I don't have to say a word.
Because Kim won't shut up.
Yeah, exactly. Yeah.
She's not bad though. She's getting way better. She's working the room, don't worry.
You need to have both of those things to make stuff happen.
Totally, yeah.
You do, yeah. So I think, we make a great team. As for the supervisor-student relationship, I'm looking forward to the chocolates. Happy to have cups of tea and wine if needed, when needed.
Yes.
But we'll have to, you know, I know that it can be very fraught, so we will keep an eye on that together.
Yep.
And it's for whatever's best for Kim is what's required. So we also have our dearly beloved James Ward on the supervisory panel,
Yes.
Professor Ward, who many people may remember. So Kim will be my first student that I supervise as a primary supervisor. And so James has obviously had experience doing that. So he's sort of mentoring me in that role. Yeah, which, yes, is a lot of raps over the knuckles, basically, from James.
And then, Kim, I'm sure you're also mentoring other people within Wardliparingga yourself. Right?
Yes,
That's how it's supposed to work.
Yeah, absolutely. And actually, I'm really excited because we've just employed someone to work with me, a young lady called Drew, in the Stolen Generation project. So I'm really excited to have Drew on board, and, you know, I want to be able to share what I learn with Drew, and that we, you know, have gone that kind of journey together. Obviously, you know, I'm doing the PhD, but I want also Drew to get benefit out and learnings and, you know, opportunities through the work as well. So she's already met some of the elders this week, which has been really nice. And so she's come from the Sapphire Coast, which is the south coast of New South Wales, and she's a Yuin person. And really excited to have Drew. But of course, we've got, you know, an amazing team of staff and, you know, people from different backgrounds. Of course, you know, we've got Aboriginal staff from various language groups, and we've got non-Aboriginal staff. And so it's important to Odette and I that people get, you know, all of the opportunities that are available to them, but also, you know, work in the ways that are important to us as Aboriginal and Torres Strait Islander researchers. So we're pretty lucky, really.
What does it mean to them to be part of that unit? Because it's very unique.
I think that people appreciate our ways of working. I think that everyone that works in our team are really committed to the course. I think we have, like Odette mentioned, the shared values. I think it's fair to say that, everybody that comes to work in our team, are committed to trying to make a difference and to improve outcomes for people and for our community. And so we're like-minded in that way, which is great. And we're quite not I don't know what the right word is, but we do take that into account when we're, interviewing people about their values and what's important to them and what interests them about working in an Aboriginal space, because that's really important for us.
Yeah, it's not just a job.
It's not just a job. It's our community. It's our family members. And when we talk about those statistics, those statistics are our people. And so, that's really important to us, that we have that right balance. And that we have people that have the right values and ways of working. So, as well as the right skills and, and the experience that's required to be able to deliver on the projects that we need to deliver on. So, but we also do care, we care about our staff, we care about their families. We talk about us being a little family in Wardliparingga and, and I think that's important for our, our culture of our team.
Yeah, it's a very multidisciplinary team, which it includes clinicians, it includes full-time researchers with different backgrounds in different methodologies, epidemiologists, people who lead projects. We've got community engagement. So it's a very diverse team. And it takes that type of team, that type of diversity to be able to deliver the research projects that we do deliver with community. And I agree, just echoing Kim, people are there for the right reasons, like a lot of, equity focus in our work. People really want to see a change in Aboriginal health outcomes. They go a bit above and beyond. We have research that is, in the community holding clinics for 2 weeks at a time, 3 weeks at a time. So the whole team is out there, away from home, away from their families. And so that takes a level of dedication, of commitment, what drives them to be part of the team. A lot of our staff have worked with us, been on the team for many years. We've also got growing numbers of research programs or projects. So we do have new team members coming in, like Drew's just joined us. We had Yuan join us
this week.
Again from Sydney. He is first time working in Aboriginal health, but has the right attitude, values. He's very funny. He tries a different coffee place every morning, and gives us the sort of updates on what's going on there. So
shocked that there's no NRL in Adelaide.
Absolutely. There's a difference between a pint and a schooner between South Australia and Queensland.
Important cultural differences.
Absolutely.
So he's learning that this week.
But, the conversation really was, he's wanting to know more about Aboriginal, the Aboriginal population, wanting to really understand. He's a statistician. That type of skill set is not easy to find in any group, for any group to find. So we also need to be developing Aboriginal and non-Aboriginal people in being able to work in Aboriginal health, because we're not going to be able to do that just as an Aboriginal population group, no matter, if everybody worked in Aboriginal health research. We need non-Aboriginal people in all places, not just research, but in our translation as well, who, have those values and want to make a difference and, willing to learn. It's an a long life journey, that learning. I've learned a lot from the South Australian community. That's completely different to, my community in North Queensland. Being in Bundaberg, again, when you move around, you've got to be open to listening and learning as you go.
What legacy are you aiming to leave at SAHMRI?
What legacy am I aiming to leave? Well, I'm hoping that through the work that we, the stolen generation work, I think, all of our work's important. But obviously, the stolen generation issues are kind of close to home for me. My dad's a survivor of being forcibly removed, so it's something that's very close to my heart. And often the stolen generation, we're really a virtual community. So at times we don't kind of get a voice and we don't really, we're kind of a bit invisible at times. And so I think being able to raise the profile of the issues that stolen generation individuals and their families experience, I think will be really important. So, leading that research, but also then, the next step in terms of what do we do about our findings, co-designing kind of responses and potentially programs. And I hope that being able to do that work over the more longer term, that can really make a difference to, those stolen generations that are still alive, but also for their children and their grandchildren and the future generations. I think that would be an amazing legacy to be able to leave, something that's really positive and beneficial to part of our communities that often, don't get services or the responses that they deserve.
We have, in SAHMRI, having an Aboriginal health theme for the state is a great achievement. And sitting in SAHMRI as an institute, we have probably, a different relationship to groups sitting elsewhere. And so ensuring that the Aboriginal health theme can continue to work its way forward in a way that is aligned with the community's priorities and the community's expectations on how we do research. And so that, I believe, those foundations with Alex have, we've carried those foundations forward. And it's like, okay, well, are they really embedded and sustained? So once we leave, is that going to be strong enough to continue? It's something we need to really look at. We think we've embedded a lot of things within SAHMRI that's broader than just the Aboriginal health theme. So that's kind of obvious in the way certain policies and, even the vision of SAHMRI, we've had influence in that from an Aboriginal perspective. To be able to have the other themes build their ability for Aboriginal research and the partnerships to be able to grow that stronger, I think would be good, because we are not going to be specific cancer researchers or, these amazing staff across the other themes and the work they do. How can the Aboriginal community be more included in those? So thinking about the benefit for the Aboriginal community from SAHMRI more broadly. And so it's the foundations of Wardliparingga. It's then SAHMRI's ability as a whole to be able to contribute to improvements in Aboriginal health outcomes. And then I think the other part of that is the Aboriginal community and organisations themselves. How do we contribute to their ability to lead research and to be equal partners in research? And I think over the decade we've definitely done some of that work.
Yes. Yep.
And that the communities and organisations in South Australia are really quite sophisticated when it comes to their relationship in research and there's a different level of that maturity across different communities and organisations, but how could we potentially, provide a sort of standardised way in which everybody can grow and take on? So how do they make decisions about whether they want to be part of research or not? How do they come up with, their own research projects and then approach partners to whoever's the best partner for them to partner in research? So it's probably, I think
that's a great
those three things, and they've all been worked on over time. And so really I think we can definitely continue to contribute to that.
Absolutely. And particularly, with the, working with other themes, that's really, we've always done that, but I think that's also a part of our, reconciliation approach. And the next step that we take with our reconciliation approach is really to work, across those, the other themes of SAHMRI to support them, through reconciliation initiatives, but also, through education and opportunities, and to, bring Aboriginal health to the forefront across some of those other areas of the organisation is probably our next vision for our reconciliation plan. So we're about to re-embark on that, which is exciting.
Well, you've both achieved so much individually and together, and I get an understanding from talking to you about just how much you're having to think about and all the pieces coming together. You can see your experience in the way that you're thinking about things on different levels now, and I think we're very fortunate to have you working on this with us, and fortunate to have Wardliparingga at SAHMRI. So thank you for the work you do, and I'm sure you'll continue doing it for as long as you can, and I'm sure we'll continue to progress.
Okay.
Thanks for having us.
Yeah, it's been great. Our first podcast.
Thank you.
Wasn't that scary?
Oh, that's good. I'll always take that.
If you want to learn more about SAHMRI and the researchers working to build a brighter, healthier future for you and your family, head to sahmri.org.au.